How can I manage my infant's wheezing, cough, and breathing? If your baby is wheezing or having trouble breathing, it can be very worrying. But there are safe ways to help your infant feel more comfortable at home while keeping a close eye on their symptoms. First, offering warm, clear fluids like small amounts of apple juice or lemonade can help relax the airway and loosen mucus. For infants aged 3 to 12 months, give about 1 ounce or 30 milliliters per dose, up to 4 times a day. If your baby is under 3 months, check with your doctor before giving any fluids. Breast milk or formula should be given more often in smaller amounts if coughing causes vomiting or difficulty swallowing. Using humidified air can also soothe your baby's airways. You can run a warm shower in a closed bathroom to create steam or use a humidifier in the baby's room. Dry air can make coughing and wheezing worse, so maintaining good humidity helps keep the airways moist and comfortable. Clearing nasal passages with saline drops and gentle suctioning can make breathing easier, especially if your baby has a stuffy nose. Repeat this as needed until the nasal discharge clears. Keeping your infant calm and comfortable is very important because distress can make breathing more difficult. Offering small, frequent feedings can help if your baby tires easily during feeding due to wheezing. Avoid giving over-the-counter cough and cold medicines to infants, as these are not recommended and can sometimes be harmful. Never give honey to babies under 1 year old because of the risk of botulism. Watch for warning signs that need urgent medical attention. These include severe wheezing, difficulty breathing, a cough that lasts more than 3 weeks, high fever, or signs of dehydration like fewer wet diapers or lethargy. If you notice any of these, seek medical care promptly. If your baby's wheezing keeps coming back or persists, or if you suspect underlying conditions like asthma, reflux, or infections, a healthcare provider can evaluate your infant and may recommend specific treatments such as inhaled medications tailored for infants. Environmental factors also matter. Avoid exposing your baby to tobacco smoke, strong allergens, or irritants that can worsen wheezing and coughing. In summary, home care involves keeping your baby hydrated, using humidified air, clearing nasal passages, and ensuring they are comfortable. Always avoid inappropriate medications and seek medical advice if symptoms worsen or do not improve. Remember, every infant is different, so consulting your pediatrician is the best way to ensure your baby gets the right care for their specific needs.